I am Dr. DeShawn Taylor. I am a gynecology and family planning specialist, and I am the founder and CEO of Desert Star Family Planning in Phoenix, Arizona. We are coming live today on Facebook, Instagram, and YouTube. And so I want to take a moment before I get started for my people here to check to make sure we're live on all of our platforms. Definitely say hello. Let us know that you're watching, and you'll also be able to watch and share later if you miss me live right now. Today's topic is pelvic exams and pap smears. And this topic is inspired by conversations that I have every single day with patients and with female patients in my clinic, because part of the intake questions is, when was your last pap smear? And I had a female patient tell me once that she recently had a pap smear at the urgent care. And so although that's not impossible, that was highly unlikely. And so I wanted to spend a little time today explaining the difference between pelvic exams and pap smears. So again, I'm Dr. DeShawn Taylor. I am founder and CEO of Desert Star Family Planning in Phoenix, Arizona, where I provide women's preventive health care, acute gynecologic care, sexual health care for women and men, and gender affirming care as well. And so let's get into this. So pap smears and pelvic exams help us assess gynecological health. And they are not the same thing, though. A pelvic exam is a medical inspection of the reproductive system, and the pap smear is a test. And so let's talk about the pelvic exam first. The word pelvic refers to the pelvis, okay, and it is an exam used for us to evaluate female organs and to check for any gynecological problems. And so when we are doing a pelvic exam, we are evaluating the uterus, also known as the womb. We are evaluating the vulva, which is the external area that the vagina opens into and includes the labia. We are evaluating the vagina, which is a muscular canal that goes from the outside vulva and attaches to the cervix. And then we are evaluating the cervix itself, which is the opening into the uterus. And we are evaluating the fallopian tubes, which are the structures that carry the egg to the womb. We are evaluating the ovaries, which are the actual structures that produce the eggs. We're evaluating the bladder, which is the sac that holds urine, and the rectum, which is the chamber that connects the colon to the anus. And so these are all of the things that are being evaluated in the pelvic exam. Now, the pap smear, on the other hand, again, is a test, and it is a test to screen for cervical cancer. And more specifically, the pap test, when begun early, as it is recommended at the age of 21, that we are actually able to screen for changes in the cervix and treat those abnormal changes before they can actually turn into cancer. So that's what's really nice about having the pap test screening at the regular intervals that are recommended. So regardless of when someone with female pelvic organs become sexually active, the initial pap test occurs at the age of 21. And so from the age of 21 to 29, we do the actual pap smear test every 3 years. And then once someone turns 30, then we began to do the pap test along with HPV testing, human papillomavirus, together as a screening. And then we do that every 5 years, as long as the examination comes back normal. And we stop doing pap smears at the age of 65 if recent serial exams had been normal or negative up to that point. And so a reason to discontinue having the Pap test prior to the age of 65 if someone has their pelvic organs removed, which is called a hysterectomy. A hysterectomy can be total, which includes removing the cervix. And so if someone's never had an abnormal Pap smear prior to that time, then Pap smears are not required after that. However, not everyone gets their cervix removed when they have a hysterectomy. And so if the cervix is still present, then we still have to do the Pap test. So I've had some patients where there was some confusion about that. They thought they had total hysterectomies, and then when I examined them, there's a cervix there, and they hadn't had a Pap smear in 10 years because they didn't think they needed one. So it's very important to have these evaluations so you can know about your health and know how to take care of yourself. And so we need to perform a pelvic exam when it is time for you to have a Pap smear, but we also need to perform a pelvic exam for other reasons. So if you are having symptoms of abnormal vaginal bleeding, you missed your period, you may be pregnant, you have a vaginal discharge, odor irritation, you have pelvic pain. These are reasons to have a pelvic exam outside of the timing of a routine examination or Pap smear testing. Now, you should have your first pelvic exam whenever you have a vaginal discharge, odor, discomfort, even if you're not sexually active. And otherwise, you have your first pelvic exam at the age of 21, when it's time for you to have your first Pap smear. And that's generally how I do this in my practice. Now, the American College of Obstetricians and Gynecologists recommends that the first female exam with the gynecologist occur between the age of 13 and 15. And so the reason for that is to establish a relationship with the gynecologist. And it's during this time where women are learning more about their bodies and oftentimes may not feel comfortable talking to their parents, although we do encourage young women to talk to their parents about their changing bodies, but this is an opportunity to be able to make sure that they're getting accurate information about their sexuality, about STDs, about how their body is changing. A pelvic exam does not occur during this first visit with the gynecologist unless the young person is sexually active. And so I've had parents come with their daughters with me to the exam, and they're upset with me because I'm not doing a pelvic exam, and I let them know that it's not indicated and I won't do it. I'm not going to force an exam on a young person who doesn't require one. And so this is very important for you all who have young people with female pelvic organs, that examinations aren't automatically happening if they're not required. And so even though you don't need a Pap test, cervical cancer screening every year, it is a good idea to have your gynecologic evaluation annually. So I recommend that my patients do come to see me every year because I still want to check in on their general health, if they are using birth control, to see how they're doing with that, do annual renewals of birth control, do sexually transmitted infection testing in people who are sexually active and at risk for sexually transmitted infection. So there are reasons to continue to see your gynecologist, even though you're not due to have your Pap smear at that time. And so there are 3 parts of the pelvic exam. There's the external, where I take a look at the outer vulvar area. So that is not the vagina itself, but the area outside where the vagina opens up to, where the labia are. We're looking at the clitoris. I'm looking at the labia. I'm looking at the skin. I'm looking at the external anal area to make sure that everything looks okay there. Okay, and then there's the second part of the exam, which involves looking into the vagina and at the cervix, and that requires an instrument called a speculum. And so a speculum can be metal or plastic, and what that is it puts you in mind of a duckbill. So imagine a duckbill, and so that's the shape of the instrument that is placed into the vagina. Now, remember that the vagina is closed. It's a potential space. And so we need to be able to open that up so that we can see the walls of the vagina, check for any abnormalities there, if there's been pain, right, or if there's been a discharge. If there's discharge, we could take a Q-tip swab and get a sample to send off to see if there's any infection that needs to be treated. And then we also take a look at the cervix, make sure it looks normal. And that's that part of the exam. Okay. And then the third part of the pelvic exam is the actual bimanual exam. Now, what that involves is placing one hand on your lower belly, and then the second hand, 2 fingers, gloved, of course, with a little bit of lubricant, placed into the vagina to be able to feel your uterus, feel the fallopian tubes, feel the ovaries, to make sure that everything feels normal. Now, this exam, there's pressure. It generally should not be painful. So you definitely want to let your provider know if you are feeling pain during this examination. Sometimes a rectal exam is required at this point in the exam. And so one lubricated finger is placed into the anus to check. And reasons we're doing that is to check for internal hemorrhoids. If someone's had a complaint they've been bleeding from the rectum, we want to do that exam and maybe get a sample to send off to check. So a rectal exam is not always included in the pelvic exam, but it is an important part of the exam when it's indicated. And so during your pelvic exam, your provider will do some of the following things. So you're going to be asked to get undressed privately, and you'll be offered a gown or some type of covering to cover yourself. When the provider comes back into the room, you'll be asked to lay down on the examination table. You'll place your feet in something called stirrups, which allows you to be in a position where then your knees kind of fall out to the side to open the area for visualization. Some tables have these upward lifts where you can actually put your legs across them. We call those knee crutches, so either or. But the point is that you're in a position where your legs are open and your vulvar area and the opening to the vagina are visible for the provider to take a look. And so then there's the inspection part 1 that I just described. Then there's the speculum exam, part 2 that I described. And if you are due for your Pap test at that time, then a little tiny brush is used to get those surface cells off of the cervix to send off for that. And then the speculum is removed, and then the bimanual exam and possibly the rectal exam is performed. And during this time, your provider should be talking to you and describing to you what they're doing. And if they aren't, then please, feel free to ask your provider to explain to you what's going on. Once the exam is completed, then your provider will talk to you about the exam. And so how do you prepare? There's not any special preparation. You don't have to shave. You don't have to do anything special. But really, if you're on your period, so if you're menstruating, to be more comfortable, it's best to have the exam when you're not menstruating for your comfort. And sometimes if you're due for your Pap test, the blood can obscure the reading. And so oftentimes we'll reschedule if that's the case. Also, we want you to have an empty bladder so the examination can be more comfortable as well. And definitely, if you have any questions, you want to be sure to write those down and bring them in with you so you can have your concerns addressed while your provider's examining you. To feel less tense during your pelvic exam, I practice deep breathing with my patients. I time breathing. I give breathing instructions and exercises to help keep people relaxed, because it can be very nerve-wracking to have this type of exam, and sometimes people feel a loss of control. Some people have experienced trauma, which makes the exam a bit more difficult, and so we want to be able to take our time. So you want to breathe slowly and deeply. So that allows your stomach muscles to go soft. It helps to relax the muscles of the legs and the pelvis and the buttocks to help with all of these things that need to enter into the vagina, right? And so you want to relax your shoulders, and again, ask your provider to describe to you what they're examining to help you kind of know what's going on and ease any anxiety you may be having. And so that is all I have for today. I hope that you found this helpful. Definitely share with people you care about and people you think may need this information. Again, if you came in after I started, I'm Dr. DeShawn Taylor. I'm the founder and CEO of Desert Star Family Planning in Phoenix, Arizona. We are live on Facebook, Instagram, and YouTube every second Wednesday of the month for Well Women Wednesdays. And so thanks again for your time. You have a great rest of your week, and we'll see you in a couple of weeks. Bye.